Good morning, everyone, and thank you for joining us today. My name is Stephen Aquario from the New York State Association of Counties. Today's webinar is COVID-19 testing through the second wave. And on behalf of our president, the Honorable and great man, Jack Marin from Ontario County, New York, the town of Victor, I want to thank you for joining us this morning for a webinar to discuss COVID-19 testing. As communities across the state are seeing a spike in positive COVID-19 cases, resulting somewhat due to the Thanksgiving holiday or living room spread as it's become known, more residents are trying to get tested. They may be having symptoms of the novel coronavirus. They may be asymptomatic. They may be trying to get out of a precautionary quarantine. They may be trying to get out of a voluntary quarantine. They may be returning home from a college or from traveling or going back to the office. Ultimately, their kids go to school or keep their business open. All of these different scenarios are in play as we go through this massive second wave. Unfortunately, the testing program in the United States is not quite what we had thought it would be at this time. The tests are not widely available everywhere in the state. And while there are several exciting innovations on the horizon, like one we saw the other day where rapid tests can be administered completely at home with no line, no labs, or wait time, we know that COVID-19 diagnostic tests still are not widely available across the state. This webinar will not provide you with all the answers that you have to the problems in your communities, but it is one that will provide information and further education. And that's been the role of the New York State Association of Counties throughout this great pandemic, beginning in March, right around St. Patrick's Day, March of 2020. We will continue to bring education and information to you. I only ask throughout this webinar that you contribute to the information spread. Instead of spreading the virus, let's spread information. Let's help further educate each other. Type questions into the chat box throughout the webinar. Offer solutions that you may have in your community that have worked, that have been successful to help in any small way. It will benefit another corner of this state. Whether you're from an urban county who have a lot of solutions in play right now through U.S. CARES Act funding, or you're from a rural county who is in need of information, education, and testing, helping each other is just one more way we're going to successfully get through the second wave of resurging COVID-19 infections and hospitalizations across the state. I want to take just a minute here and talk about the different types. There's a lot of words that are involved with this issue of testing. And Ryan and Jason and Jerry and Tom Carey here in a minute will help walk us through a lot of these terminologies that's going on here. Surveillance. What is surveillance testing? Generally done randomly sampling a certain percentage of a specific population. An example of surveillance testing is a testing plan developed by the state to randomly select and sample a certain percentage of a certain city or village or town. Screenings for COVID is another term we've heard a lot about. Examples of screening include testing plans developed perhaps by a college or a school to test all of the students and all of the faculty returning to the school, regardless of exposure or signs or symptoms. We've heard a lot about in the newspaper, on the television, all over about diagnostic testing. Well, diagnostic testing is looking for occurrence at the individual level and not a population level, like screening and surveillance is. Diagnostic testing is bringing it down to an individual for a particular reason to suspect that an individual may be tested. And there's a couple of different types of diagnostic tests, diagnostic testing and antibody testing, which we've heard about. Diagnostic testing can show if there's an active corona infection and should take steps to quarantine. Currently, there are two types of diagnostic testing: molecular, such as RT-PCR tests, that detect the virus's genetic material, and antigen tests that detect certain specific proteins from the virus. And antibody tests look simply for antibodies that are made by your immune system and our immune system in response to a threat such as a virus. There are also certain alternatives to diagnostic testings, such as rapid point of care testing, which is using a mucus sample from the nose or the throat, but can be analyzed at a point of care. And so lots of different solutions here to the various problems across the state. I'm very happy to have our speakers here with us here today, and let's get to them. But before we do that, I want to recognize our sponsor for today's webinar. We can't do this without our sponsors. We cannot continue to provide such a high level of information without those that support county government and those that support the New York State Association of Counties. And with us here today is the Vice President of Government and Strategy for an outstanding company called Let's Get Checked. I'd like to introduce a good friend of NYSAC and a good friend of many of you on this webinar. Tom Carey is a New Yorker through and through. And Tom Carey, let's have you say a few words about Let's Get Checked and what you've been up to.
Thank you, Steve, and that was a great introduction. Really appreciate it. And so Tom Carey, Vice President of Let's Get Checked. And as Steve, you did such a great job, and I don't think I need to remind everyone on the call, but it's just always very impressive to me, Steve, the time and effort that you put into educating yourself and your counties about a particular subject. And I think one of the most important subjects right now is COVID testing. Obviously, everyone's excited about vaccines coming out, and we hope that those come out as soon as possible and everyone gets vaccinated. But until they are out in the mass public, I think testing is going to be key to keeping people safe and healthy. I joined Let's Get Checked as a result of the COVID pandemic. As Steve said, I'm a New Yorker. I've grown up in New York. My father was the former governor of New York. I traveled around all 62 counties with my father, campaigning for him. So I know New York, and I know the counties, and I know how much work the people on this phone call put into keeping their counties healthy. So Let's Get Checked is an at-home testing diagnostic company that has been around for about 5 years, based out of Dublin, and now we have a New York office, and our lab is in California. We do COVID testing, and as Steve, you did so well breaking down the different types of testing. Ours is a COVID PCR test, which is really the gold standard of testing. There are a lot of different tests out there. They're all great for different purposes, but the PCR test has the highest sensitivity specificity out there. And in layman terms, that means it has the highest percentage chance of catching the COVID infection. So what you want to do when you're testing your populations is give yourself the best chance to catch that infection as possible. So ours, we have FDA approval for at-home collection, basically meaning that you do not need to have staff do the sample collection. It can be done by yourself. It is a lower nasal swab. You do 10 seconds in each nostril, and then we can ship that to our lab through UPS, our exclusive shipping partner. And we get that to our lab, and we get the results back to you within 48 hours of the time it received in the lab. So we have worked with all different types of testing partners out there, from state governments, county governments. In New York, we are working with multiple universities. We're working with Syracuse University, Lemoyne College, Colgate, and many of those came through the leadership of Steve and County Executive Ryan McMahon, who said, before you bring thousands of students into Onondaga County, I want to make sure that they're healthy and they're not infected. So we had many calls with Steve and County Executive McMahon and the Chancellor of Syracuse to say, we want to bring back in excess of 15,000 students. How do we do that where you're bringing thousands of people into a mass setting in a healthy way? And they did it through testing. And we were able to get them convenient testing where we could mail those to the students at home, have them do the self-collection, send it to the lab. Everyone gets their results either on a website or an app. and then we give results back to this case, the university. And we also work with the state health department e-clears to make sure that you're getting the results back to the health department as well. So, you know, what we bring to the table is a convenient way to get testing to people so they could do self-collection and work with the population. We know that the counties have different needs, whether it's getting them in their health department for rural counties, but we would love to just, you know, listen to see what your needs are and how we could help with those. I can't thank Steve enough for the partnership that he's given to Let's Get Checked to say, listen, this is what our counties need. How can you help us? So we're here to help you, just kind of give you another example of testing and what we've learned from working with state governments like California and Florida, and big counties like LA County, Ventura County, Tarrant County, Texas, Douglas County, Nebraska, and obviously in discussion with many counties in New York and working with college universities. So again, thank you. I think you're doing great work. We would love to see how we can help you with testing, whether it's just comparing different opportunities or giving you some of the experience we've found from our customers. So with that, I'll turn it back over to Steve. But again, thank you and congratulations on the great work, Steve.
Thank you, Tom Carey. I appreciate all you're doing, and thanks for always being there for us. We're joined today by representatives from Lewis County and Tompkins County, New York, to discuss their COVID-19 testing response. I'd like to take a moment to thank Lewis County Manager Ryan Pichet and Lewis County Health System Chief Executive Officer Gerald Kayer for joining us. We also have the Tompkins County Manager, a great friend and great public servant, Jason Molino. Thank you, all of you, for joining us this morning to discuss this very important topic on COVID-19 testing. Again, I want to remind everyone during the presentation, type questions, comments, concerns into that chat box, and we'll answer them when we have time. I want to thank everyone for being with us here, and I'm going to take a moment to discuss Onondaga and Broome County here very quickly here. Just want to give some folks an example of Jason Garner, the county executive in Broome County, of what they have been doing here, converting a mass transit bus seats from a county, Broome County, BC transit bus were removed, all the seats, to make room for a rapid PCR testing machines supplied to the county health department by the state of New York, and thank the state for doing that. This was, of course, during the early and mid days of a yellow zone and how the county worked to test its citizens and residents and folks from around Broome County. County wanted a test site that people without a vehicle could simply walk to, and that could be moved around without a vehicle. They could walk to, move around as the virus continues to spread. The testing on this bus is free to Broome County residents and is available only to symptomatic individuals, COVID-19 symptomatic individuals. Residents of Broome County had to register for appointments online or call 211, a very successful and innovative approach. Those of you that are interested in that mass transit model, we have a manual from Broome County that is available for you if you would like to review the procedures and protocols used by Broome County. Similarly, Onondaga County has also come up with a new program to do asymptomatic testing in the county, new testing for its residents who are asymptomatic and have not had direct exposure to a positive case, but nonetheless are experiencing some form of anxiety, fear, or need to be tested to return to work in the event of incidental exposure or an event requiring them to get a test. The Emergency Operations Center workers are now staffing that test site at the massive on-center convention center in Onondaga County. The county reporting it can administer 450 rapid tests per day between the hours of 9 and 4, and residents are making an appointment through a county portal that they have put up there. Lots of folks watching Onondaga County as it continues to work with SUNY Upstate Medical Center on providing these types of testing. But what we want to go to now, and we're very appreciative of their time, is go to our panelists, our friends and colleagues from Tompkins and Lewis County. So let's tee it up first with Ryan Pichet, the Lewis County Manager and a fine public servant as well. Ryan, thanks for all you're doing.
Yeah, thanks for having us, Steve. It's an honor to be asked to share some of our experience with the rest of the state.
And
Yep.
Jerry, go ahead, Ryan.
Good morning.
Morning,
Yep,
Jerry.
you just go back one slide, I'm sorry. Again, thanks for having us. You know, I just want to say off the top that this is by no means, you know, the best way or the right way to do testing. It's just the way that's worked for us, and we're happy to share our experience. The theme so far in Lewis County since March has been naturally together. That's kind of the hashtag that we've been using, and I think it's appropriate for this because really this testing that we've put together for the community is a collaborative effort for everybody. Lewis County has one advantage when it comes to testing. We are one of only 2 rural counties in New York State that has a county-owned health system. The other one is Wyoming County. Most of the time that creates a little anxiety for Jerry and I because, you know, we have a enterprise fund that has a budget almost twice as much as our general fund, and Jerry is in a competitive healthcare environment with the restraints and expenses of government. So, but during a pandemic, it's actually very convenient, and it's created a lot of wonderful partnerships. A little bit about Lewis County. We're the 4th smallest county by population, but we're spread out over 1,200 square miles. So a relatively sparsely populated area in Lewis County. You can go to the next one. Here's the current situation in Lewis County. As you can see, we were relatively unscathed until about October. You can see 3 distinct spikes. One is from a baptism. That was a super spreader event in mid-October. The second was Halloween, and the third is Thanksgiving. So relatively predictable. You'll see the hospitalizations are beginning to creep up as well for a small hospital. That is, you know, certainly worrisome. Next slide. As you can see, our COVID-19 situation right now is centered around, you know, really what you'd expect right where the people live, right along the Route 12 corridor where the majority of our population is. Next slide. So what we want to talk about today is comprehensive testing in Lewis County. You know, we've been able to accomplish symptomatic testing, general community testing, surveillance testing, school testing, and nursing home testing. And we also want to talk about some of the challenges to providing those testing in a rural community. It's hard to get test kits. Laboratory processing can be a challenge. Entering the eClears data is something that has been a big challenge, and something that we've heard from some of our peer rural communities that don't have a health system, that it's difficult to get their private health systems on board with the laborious task of entering all that data into the state database. Staffing, PPE, appropriate physical space, and of course the cost. We're going to hit more of these in some more detail, but Jerry, I know you wanted to talk about the physical space and the challenges we faced with that, and anything else you wanted to highlight in terms of challenges before we get into the program that we put together.
Sure, Ryan. The physical space is really a factor of the weather now. You know, testing the last 2 days, it's been 20 degrees in the morning. This has really forced us to move off our campus. We have tried initially to have testing on the health system campus, and during the summer, we actually brought the testing out to the population centers in Lewis County. As the weather cooled off and we were more engaged with schools, we brought all the testing on that health system campus. And over the last few weeks, we are now renting space that allows us to drive in, get tested, and then drive out. So I think the key among all of the testing challenges is flexibility, because what presents in the summer is different now as we get closer to winter.
Yep, next slide, please. Symptomatic testing is one of the most important things that we you know, have to provide for the community, especially when we know somebody that has symptoms and you know, comes through public health and is quarantined as an exposed. We certainly know that that's going to create issues. We have a drive-through clinic that is at the health system twice every single day, Monday through Friday. We use the Lewis County Mobile Command trailer for that. And this is a photo on the right that was taken from Jerry's office yesterday. So you can see the cars really line up early on to get through our symptomatic testing. One thing to highlight is the eClears entry. Like we said, this can be a time-consuming process, and we are lucky in this scenario that Lewis County Health System and Jerry's staff is willing to take on that burden to enter that system when the positive cases are identified. Jerry, anything to add about that? One amendment is that it is not charged to insurance. It is actually a free program. So, Jerry, anything to add?
Yeah, no, I think just want to emphasize that it is free, and we are doing two type of tests at this morning clinic and afternoon clinic. We're using the rapid antigen test. You do not need an analyzer, but if someone is presenting symptomatic, we are also swabbing so that we can send the results to the state-sponsored reference lab that we're working with.
Yep. Next slide. Okay. This is the operation probably that we're most proud of. It's a general community testing. We're getting about 100 to 200 people through this clinic a day, which means we can serve 200 to 600 people a week, which for Little Lewis County is pretty good. This is a example really where our excellent teamwork has produced a great product for the community. I went through yesterday, got tested, and took some photos. It took about 40 minutes to get through the line of cars and through the testing site. We are renting space. It's a very Lewis County solution. It's an old horse barn on a great community site with a long driveway, and it just seems to work perfectly for us. Lewis County government pays the rent. Lewis County Health System staffs the clinic, and New York State provides test kits, PPE, and the lab to get them tested. So that's something that's been quite good for the community. Next slide, please. We started at the health system campus, like Jerry said, using the mobile command trailer. And as the weather changed, we needed to move into the new solution. One thing I like about this slide is the photo in the center. That is Jerry's staff and public health staff working together to staff this clinic and make sure people have access to testing. Next slide, please. And this is our new location and some of the photos that were taken yesterday. Jerry, anything to add on our general community testing?
Moving to the new winter site, the timing was perfect. As we started seeing the increase from the super spreader event in October, we did not have enough blacktop to accommodate all the cars that were lining up, and the backup was nearly a quarter of a mile on State Highway 26. This present location allows us now to weave the cars through a pretty large dirt road infrastructure without cars backing out onto the road. So it's actually much safer.
Yep. Next slide, please. School testing is the other piece of the puzzle that's been important for a comprehensive testing plan in Lewis County. The photo there is a photo of our Zoom call yesterday. We do bi-weekly Zoom calls with all the county superintendents. Easy for us. It's only 7 school districts in Lewis County. I understand that gets more complicated for some of the larger counties. But basically our goal here is that all symptomatic staff and students have access to rapid testing. We know they can't return to school. Even if you leave with a runny nose, you can't return to school unless you've proven that you have a negative test. So we want to make sure that those tests were available to folks and get them back in school, especially in small school districts. It only takes a couple bus drivers, a couple cafeteria workers to knock out the whole school for the day. So it's important that those staff can get back to work. Next slide, please. The other thing with testing that I think is important is that we have set ourselves up for a microcluster designation. So if we do go into the yellow, red, or orange zone, we have to provide 20% testing for the entire population of the school and staff. We have already pushed out test kits, the appropriate number of test kits, to all 7 of our school districts, and Jerry's staff has already trained each of the school nurses, EMTs, whoever might be on staff there, to provide those tests to the students. So if we do have to go down that road, we're ready to hit the ground running right away. Jerry, anything on school and our relationships that we built with those guys?
Yeah, I think this is a real success of the partnership. We started meeting regularly with the schools back probably towards the end of July, and have had a series of meetings as they were putting together their school opening plans. The Frontier League, which is based primarily in Lewis County, had a boys and girls soccer schedule, and there was a point where one of our schools had some students test positive. So the protocols that we worked with the schools around supporting faculty and staff testing and student testing were instrumental in limiting the number of days they were completely virtual. So I think this has been an ongoing relationship. We are now at a place where any faculty person, staff person, or student that needs to be tested, we've set up the system where those individuals can be quickly tested. As Ryan stated, with limited faculty and support staff in the schools, the superintendents and principals need to know quickly if they have to replace someone. And if too many people test positive, then they will have to shut down.
Next slide, please. Next slide, please. We did want to get a little bit into the weeds on managing inventory, because this is a pretty tricky and critical part of the operation. Supplies, the cost of supplies, and the matching of supplies has been a real challenge for us working with the health system. When I talk about matching, you have to have a test swab. Sometimes if you're going to do the test in-house, you have to have the right machine. In order to have the right machine, you have to have the right reagent. And if you don't have a machine, you've got to have a partnership and a relationship with a laboratory that you can mail the test to and get the result. So Jerry's going to run through some of the details here and why this is important. But basically what we want to show is the complexity of this and why it's so great that we've had a relationship with the health system that has a lab that can assist us through this process.
So this overview that you're looking at now has changed since yesterday, and I think that's one of the take-home messages. This part of the process evolves. So I would encourage you not to get focused on an individual block in the matrix, but rather the takeaway is the ability to have a number of labs available to you and a number of different analyzers, and also relationships with the organizations that will provide the test kits for you. So we were early adopters to the partnership with New York State. We completed the contract review in mid-August, which made it possible for us to receive the Abbott antigens and the Abbott PCRs. The Abbott PCRs require an analyzer, the Abbott antigen does not. So that allowed us to expand access at no cost to the community, to the schools, and to individuals public health was keenly interested in. So every single morning we receive a communication from schools and public health and human resources in the health system for anyone who is presenting symptoms. And so they are tested first thing in the morning. We are fairly comfortable with the supply chain for the antigen. We are less comfortable with the supply chain for the PCR. So that is reviewed daily. And right now, as of this morning, we have as an example, we have 5,000 antigen test kits. However, on the Abbott PCR, we only have 85. And unless those shipments come in with some degree of frequency, that could be a resource that's not open to us. Our foundation purchased the Cepheid analyzer, which has been well received. However, we have been challenged in getting the Cepheid test kits. The Roche is something we've been working on over the last several months. And as of today, we have 3 analyzers and 334 test kits. The materials management department for the hospital has been very proactive in meeting all the goals we set for both PPE and for test kits. And then lastly, the BioFire respiratory panel. That one's interesting. You'll see the price tag is $800. It's a full respiratory panel. In the very early days of the pandemic, that's what we had available to us. And you can see it's cost prohibitive to use that resource. What is not on the slide is the mandated nursing home testing that we must do both for staff and for the residents. That one is by DOH mandate or guidance. And right now we are testing employees twice a week and residents twice a week. The health system had to go out and renegotiate its reference lab contract. We made a vendor shift as a result, and we are spending right now today $49,000 a week or $100 per test testing residents and employees of the nursing home. Part of that is driven, we had a small outbreak on one of 4 units, and there are a number of requirements when one of your nursing facilities has a positive COVID test. So we have to make sure everyone is COVID negative and be able to maintain that for 14 days. We are probably 4 to 5 weeks before we'll be able to achieve that goal. And until we can achieve that goal, we'll spend $49,000 a week in testing. Once the goal is achieved, that number will be cut in half because we'll be able to cut in half the number of tests we do.
Very good. Complicated process. That's kind of the message we wanted to send here. Next slide, please. Impact and lesson. The impact, the positive impact is we have a comprehensive testing regime in Lewis County. Asymptomatic people have access 3 days a week. Symptomatic people have access twice a day. School personnel have access basically anytime we put them in the front of the line. And of course, nursing home testing. We have a reasonable timeline for test results for the most part. Sometimes the state gets a little bogged down with their lab. It takes, it can take up to 5 days, but for the most part, it's about, 2 to 3 days, which is good. Another impact is it's disrupted our hospital operations, as Jerry's talking about. Not just the staffing challenges. We pulled folks from all kinds of clinics, dermatology clinics and, community clinics. They're all working and chipping in on testing. And then, of course, the cost challenges, as Jerry mentioned. Lessons, collaboration is the key word. Partnerships with New York State, partnerships with our local schools, partnerships with the health system are really what has made this possible. And, allowing everyone a piece of the pie and everybody to help split the cost in some way. Communication, Jerry and I have done over 12 media briefings at this point where we've tried to push people towards our testing. So just offering it is not enough. You got to make sure that you're pushing it out there as well. Flexibility, as Jerry mentioned, there's no one test answer. You're gonna have to put this together like a puzzle, using different labs, different testing equipment, just like we talked about. And then evolution, this is not a static process. This is going to change as community positivity rate changes, as the needs of our schools change, as the seasonalities change, and as, of course, we're all used to at this point, the governor's guidance change. So with that, we'll wrap it up and take any questions.
Okay, thank you, Ryan. Why don't we hold on the questions until we go through Tompkins County presentation, and we're now joined by Jason Molino and also Frank Krupa, the Tompkins County Public Health Director, and I'll have Jason further introduce his guest that he has with us. Jason Molino, let's hear how Tompkins County is not only helping the people of Tompkins County, but the region of the state and perhaps folks from all around the state, as you had a lot of traffic coming in from all corners of the state seeking a test from what you have done and the innovation and best practices that you have put in place in Tompkins County. Floor is yours.
Thank you, Steve. I appreciate the opportunity to be here, and thank you for NISAC for putting this on. We always appreciate all the information and the webinars you guys put on. They've been enormously helpful since March and even before then, so I appreciate that. With me, we have our Public Health Director, Frank Krupa. Frank and I have become very close over the past several months. He's a household name in my house. When he calls, my kids go, "Oh, it's Frank. It must be the coronavirus." So Frank, thanks for joining us last minute. I appreciate it. We've been, I think, very blessed with a unique situation here, and I would stress one thing from Ryan's presentation that is very consistent with ours, is that partnership is a huge piece to this. And we don't have a local hospital, obviously. We're not the other county in the state, but we do have a good local hospital system here, Cayuga Health Systems. What's really been, I think, key to this has been our relationship with them, the communication. What's been very helpful is that we've had local leadership here. We've been able to work closely with them from the early parts and from the early stages of this in early March. And they've been really able to stand up what has turned into now 2 testing sites in Tompkins County. And I'll talk a little bit about, before we go to the next slide, let's go to the next slide, and then I'll talk a little bit about what we've been able to do here. So Cayuga Health Systems in March, as we were all getting ready to address this issue, so we want to start a drive-through testing site, and Frank and the public health team and the Emergency Operations Center worked very closely with CHS to establish a testing site, which is actually was set up originally and still exists in the mall parking lot of a mall just outside the city of Ithaca. And they were able to stand it up rather quickly. At that point in time, it was, anybody could get served, symptomatic or otherwise. They set up an app to easily be able to register, and nobody was turned away. And we were able to set it up rather quickly and became and continue to be a regional location for testing, because there was no other state testing site at the time, I believe, other than in Onondaga County. Binghamton's came online a little bit after ours. So we were able to support our county, we were able to support the region. And if you remember at that time, as we were talking, as we got through March, April, and May, they were talking about reopening, and being able to reopen, you needed to have a certain capacity of testing. And this definitely played an important role, I think, in our region being able to reopen. As you can see here, some statistics, the 650,000 tests to date. This includes a partnership also with Cornell University. So to give you a little bit of a background in our county, we're a county of about 100,000 people. Cornell University, Ithaca College, and Tompkins County Cortland Community College are 3 higher ed institutions in our community and are a big part of the community itself. So Cornell itself, 20,000+ students, played an important part, and I think it was an important partner with CHS and the county being able to do the amount of surveillance testing they wanted to do. I'll go back now to the drive-through facility that CHS set up. Throughout that process, they had an app that was established for folks to be able to register in, and around maybe June-ish or July-ish, there became issues with health insurance not reimbursing for non-medically necessary testing. And at that part, we were able to partner with them. The county legislature approved funding, so where we could contract with CHS to be able to provide free testing to Tompkins County residents. They still take all the information, and if they are medically necessary tests, they still go through the insurance. But other tests we cover in terms of a county making it free to all Tompkins County residents. Those charges that we get charged on a weekly basis from the hospital, we then turn around and submit to FEMA for reimbursement. We have not yet received reimbursement from FEMA, but every week we file those claims, and I have a slide later that talks about the amount of tests that have been provided and then what we've paid for to date over the past, I want to say, close to 12 to 15 weeks. Frank, do you maybe want to talk a little bit about the setup of this location in March and how it's transformed to date over at that location?
Sure. We started with a smaller drive-through at a building just adjacent to the mall, and then it expanded to the larger drive-through as we saw demand was only going to increase. Cayuga Health Systems stood up the testing. It's essentially run with their staff. They created an app, as Jason alluded to, that you can pre-register through, and the testing has evolved to where they're putting through about 700 people a day now. It is PCR testing, so we are getting those results usually within 24 hours, probably 85 to 90% of the time, but always within 48 hours. So we're getting rapid results on PCR testing there at the mall. And they have expanded to a second site that Jason alluded to downtown, which was downtown Ithaca, which was designed for walk-ups. And they are actually doing saliva testing there as well. So it's a less invasive process. It's still a PCR test. It requires the collection of 3 milliliters of saliva, but it's less invasive. And it does allow for a PCR result within the 24 to 48 hours as well. And they're seeing upwards of 200 people a day at that facility, and they continue to adapt and grow hours and days open. Right now, they are 7 days a week at the mall drive-through site, 5 days a week at the walk-up site downtown, with plans to expand that to 7 days a week as well.
Frank, so one of the things I think it would be good to talk about is where the testing is locally, and we're not having to send it out to a lab. So one of the things we did in March or May or June, we purchased a Reonics testing machine, as well as the city of Ithaca, as well as some community funders, as well as a hospital, to be able to have much quicker turnarounds. So what Ryan mentioned earlier, everybody was experiencing, and probably still is to a certain extent, really delayed turnarounds on the samples to being able to be tested. Can you talk a little bit about how that helped, and then also how does the Cornell surveillance testing fall into this?
Yeah, so the purchase of the Reonics equipment really helped amplify the capacity at Cayuga Health Systems to make sure that we could continue to get those 24-hour turnarounds. We have seen 24-hour turnarounds since March with our results, and that's been consistent. And it's because Cayuga Health Systems, with the support of the community, has been able to expand their capacity with the equipment. The Cornell surveillance testing came online with the beginning of the semester, and what they were able to do is transform what is a world-class veterinary laboratory to be able to process these samples with approval from the state. And so they are, during the semester, they were testing roughly 6,000 people a day because their students are required to be tested twice a week as part of their surveillance program. So they had to build their capacity for the student surveillance process, but really what that's done is added capacity for testing in our community. So the Cornell laboratory works under the Cayuga Health Systems umbrella, and so they're able to share capacity back and forth. So as testing numbers went up, the Cayuga Health Systems was able to use the laboratory at Cornell to process samples as well, which has really helped them to be able to expand even further to be a community resource. Cayuga Health Systems is in all the contiguous counties and beyond in our region doing testing because of the capacity that's been able to be built here locally.
And that also helped Cornell and Cayuga Health Systems were able to assist some of the school districts, particularly the largest school district in the county, Ithaca, to be able to do some preliminary testing before they opened for in-person schooling. And a lot of our school districts are doing, all of them are doing some form of in-person schooling, but also they're balancing the challenge that Ryan alluded to earlier. I think we're all dealing with students getting sniffles or getting sick and then having to get tested. So it's definitely been able to add a greater capacity to allow those folks to get tested. Could you go to the next slide, please? Great. So, you know, part of, as I mentioned earlier, a big part of the relationships that we have and the ability to maintain those relationships, both with CHS, Cornell being an important player in the community, and that involves a variety of different communication methods, obviously daily debriefs as to what's going on. We continue to provide logistical support. The downtown site was actually one of our buildings, a vacant building we had recently purchased that we've not done anything with yet. So we were able to let them use the facility in order to set up the downtown location. I went there yesterday. It's a good location. Was able to administer the test easily, and it's worked out very well. Continue regularly with public information. So we have, just so you understand how we're set up in our organization, we have a communications director out of my office, and we've actually pulled in about 5 or 6 other people from different departments that act as a support to a PIO team. And this involves massive amounts of public information, whether it's through press releases, whether it's through Twitter, other posts, a lot of other posts. We've been working regularly with our local media to get stories around testing, and I think it's been well received by the community because we get a lot of use. I mean, there's a lot of tests that are being administered. Our health department's still doing case investigations. Yesterday we unfortunately had our highest day ever with 65 cases in a single day. We have a great group of public health nurses that are doing the case investigations, and we probably reassigned close to 30 to 40 staff throughout the county from other departments to do just contact tracing, and we're actually updating the scheduling now in order to be able to accommodate the increased caseload we've seen and what we expect to see in the next week. Next slide. This just kind of gives you an update. I probably should have put this first to kind of give you an understanding of where we are. In terms of the number of cases, these are Tompkins County cases, pending results, positive cases. We unfortunately around the Thanksgiving mark surpassed 1,000 cases. This is something we update regularly. As you can see, this was updated as of 7 p.m. Yesterday. And, for us, we saw some little spikes in March, April that then died down into the summer months. We saw a few clusters in September. I think that might have been more also related to higher ed coming back. And then it died down a little bit till probably mid to late October, where we started to see some growth regularly, and then into November, and as what we're seeing now, which you're all seeing. So we've tested over 500,000 times in Tompkins County, which includes the Cornell University surveillance testing program. I think it's CHS has done over 550,000 tests at that location or those locations, which include residents from other counties. Next slide. So this is one thing we do every 2 weeks at the legislature meeting is we give a kind of our COVID update. It's actually a similar format that we do every 2 weeks. It's turned into, I think, 120 slides at this point. It's chronological, but this is one slide we've been including since we've been doing the testing, as you can see, and I'll start on the left column, moving to the right. The week, we started the first week of September. Total CHS sampling, that's of all counties, so all the tests that are administered throughout that week. Tompkins County residents only, those without symptoms, those with no sponsoring organization. So that I should identify that if businesses or organizations want to do surveillance testing, they are required to contract for it themselves. We don't necessarily cover that, but if there's a business that wants to put their folks through it on a regular basis, they generally contract directly with CHS. The weekly cost to us, the Tompkins County percentage of those that are tested, the expected FEMA reimbursement, I should say expected. We've been religious in ensuring that we're filing it as quickly as we can, but that's the expected reimbursement at 75%, and our cost would be $170,000 to date. The legislature approved $300,000 to be spent. That is net cost to us. So we'll probably go back to the legislature at the beginning of January to discuss continuing the free testing to county residents, at least for the immediate future. I should also add that all our employees obviously are covered under this as well, even though about 35% of our residents don't live in the county. We've covered all of our employees if they want testing. Next slide. Here's just some pictures that we put together. This is the drive-through. These are the drive-through site. Frank, you were probably more involved in this than I am, so I don't know if you want to run through just a few of these pictures. I think they're pretty self-explanatory, but
Yeah, so Cayuga Health Systems was able to stand up some tent structures for their staff to work under. But the way that it's designed is that you pre-register, including taking a picture of your ID if you have it and your insurance card. When you get to the site, somebody checks you in. They run through the information to make sure your pre-registration is complete. If you didn't pre-register, they can register you on the spot. But once that's done, then you move up into the tents where the clinical staff reviews to make sure they have the right person, and then they administer the nasopharyngeal swab for testing. So it's a relatively smooth process. Generally, it takes about 20 minutes to get through. On super busy days or when we've had a public exposure that we've announced, that our waits can rise up to about an hour, but generally it's a relatively smooth process for folks to get through.
Thanks. Next slide. This is just an example of the sampling center downtown. So it was a former dental building that we ended up purchasing. It's right on the corner from our office. It's within walking distance of the downtown core. And these are stations set up where people spit into a cup for the most, for the lack of a better term. But the locations worked. It's one way in, another way out. And they also have an area for symptomatic individuals to provide their sample separate from this as well. Next slide. That's it. I did put a link on here, local data and trends. We do have more graph and information around the data pertaining to us. I didn't include in this presentation. And also, if any folks wanted to see the specifics around the Cayuga Health sampling site, there's a link there for folks to go to see how they set it up. I should also add that we have Cornell, as well as the college, have dashboards related around their populations, as well as Cayuga Health System. So there's a few dashboards that are around if you wanted to see how they're monitoring and how they're reporting out on this type of data. Seems to be very important for the public, and both organizations, all organizations have been pretty transparent in how they've been able to report it. So there's some different dashboards available on our website, or links to them if you wanted to see what CHS, Cornell, and Ithaca College are doing. I think that's it, unless, Frank, do you have anything else you'd like to add with respect to the testing?
I would just offer that it was a community effort. Without partnerships like Cayuga Health Systems, Cornell, and many other community partners, none of this would have been possible. So those relationships you were referencing were key to being able to have testing available. And I am completely confident that our testing is what's helped us keep our disease numbers low, because we're identifying people quickly and getting them into isolation quickly.
Thank you, all of you for joining us today and sharing this information. We do have a few questions that have come in, I guess for Lewis or Tompkins, on testing supplies from the state. You anticipate a shortage. How's the supply chain going with the testing supplies? Are you anticipating any degree of shortages? Brian, we got to get you unmuted. Okay, good. Somehow we're having an audio problem there.
Sorry. All I wanted to say was Jerry would be better to answer that. So.
Okay, cold weather, logistical challenges is another question that's come in. How are you, what are your thoughts, preparations, questions, comments, concerns surrounding the inclement weather that we are likely to go through here? These very difficult months, December, January, February, going to be in a deep freeze. How are folks logistically going to handle this? Of course, we're used to the cold weather up here, but not like this. Any thoughts on the logistical challenges surrounding cold weather?
Sure. Frank, I know we've had just some recent conversations around this and taking that outdoor site and indoor. Do you want to talk a little bit about that?
Yeah, so the drive-through at the mall, the tents are not enclosed, and we are certainly concerned about the weather. we've already had issues with high winds and the tents. So the downtown site was a first step towards having an alternative location, but we're working with Cayuga Health Systems to try to find something where they can have more shelter for their staff. We're also looking at expanding the saliva testing availability, because that can be done and collected by the individual patient in their vehicle. So it doesn't require staff to be out collecting samples. So we're looking at multiple options, but it's definitely a concern, because the most efficient method to do this testing is through a drive-through, which I think everyone has experienced at this point, but that doesn't work so well when it's below zero, and or you're trying to remove snow when you've got cones and barriers and other things set up. So there's some logistical challenges to work through.
From our perspective, that's why we changed the site from the command trailer to, I jokingly referred to it as a barn, but it's a very, very nice barn, and it's heated, and there's an area to segregate staff so that they can be heated. They could come out, provide the test, and then go back. So I think that's our plan. Our highway department will of course work with us to clear that Tug Hill snow, but our drivers are also used to it. So I think our winter plans are pretty set. Jerry? Yeah.
Okay. Yeah, I would agree with that. I think the winter facility is no longer an issue. We've made modifications over the last couple of weeks to limit the wind coming in as the doors are up and the cars are driving through. So I think we're good there. With regards to the earlier question regarding test kits and supplies, for the most part, I'm comfortable with the supply chain flow we have from the Department of Health. The one area where I think we're at risk is the Abbott ID Now, which is a PCR test, and that's the one that is highly reliable. And you know, week to week, we are evaluating that one.
One of the questions that's come in, again, is sort of similar, related to what we have been discussing here, is that supply chain sourcing issues. How are you getting the tests? I guess is the question from this viewer of the webinar. Where are they coming from? How are you able to get this chain of tests?
So yeah, so we have multiple vendors working through the health system. So that's one way. Very early in the summer, our goal was to have 120 days of supply for both PPE and test kits. And by and large, we've done very well on the PPE. Test kits, it's an ongoing challenge. So we set up internally what we call the COVID action team. And that's one of our daily dashboard items that we review. And in addition, as we work through that, we also provide real-time feedback to Haney's so that they have a pathway to give information to the DOH. So I think it's just ongoing oversight, bird dogging that particular topic. It is a fair amount of time spent by our materials management staff. With regards to the state supplies, if we hit a point where we're really challenged and the supplies aren't coming in, we work with the Emergency Preparedness Office of the county, and they become a conduit to give feedback to the Department of Health.
And we're not doing rapid tests here in Tompkins County, so our supplies aren't coming from the state. Early on in this, we had to source locally the different components and build them with Cornell's help and the hospital system. But to date, their supply chains for the PCR testing and the Reonics equipment has been solid to be able to continue to do testing without any delays for supplies.
Jason Molino, you mentioned something earlier. One of the viewers has asked us to follow up this question on FEMA reimbursement. Very important, this issue of FEMA reimbursement. Of course, the state has reached a threshold where I believe it's 90% reimbursement now, a 10% match. How are you doing the FEMA reimbursement? The question surrounds FEMA reimbursement. Can you elaborate?
Sure. I can a little bit, and I'd be happy to follow up with an offline conversation with someone, as I don't have all the details. But I know we have filed it. We filed our FEMA reimbursement with FEMA. Obviously, the state additions folks are aware of it, and we did a lot of confirming with both our FEMA rep as well as the state to ensure that if we were to contract with CHS, that it would be reimbursable. And we received multiple confirmations that contracting for testing is reimbursable. So right now, like I said, we get the bill, we pay the bill. Once the check is cashed, so to speak, we then submit all the proper documentation so that we start a new project every week after every filing. From what we've been advised, it's at its final reviews at FEMA. We have not received a reimbursement yet. I would add that this is done separately from our other expenditures. So we do this one on a regular basis every week, but the other expenditures related to every expenditure that counties are going through for FEMA reimbursement in response is not done with this filing for this specific service. So I'd like to say the check's in the mail, but we're I think at the final stages of review for at least our first 4 to 6 weeks. We're in constant contact with them every week, and we're just waiting for approval. And I think I did forward some of that information to you, that I know when we do get paid, I will share that information with you as well, so that people are aware, when we do get the reimbursement, assuming we do.
Are you working directly through FEMA, or are you processing that through the state of New York?
It was done directly with FEMA, but our folks at Dishes are aware, are fully aware and understanding of it.
Okay, thank you. Next question concerns the app that was created by Cayuga Health Systems to allow residents to register for these tests. Can you let folks know how that came about? Is that something that can be replicated around the state?
Yeah, it was actually their ITS folks built it. It's a component of their existing IT infrastructure. So when we say app, it's really a mobile registration site, cayugahealth.org, if anyone wants to go take a look at it. And it allows for the capturing of registration data, as well as documentation for identification and insurance as well. So it was an internally made system that they've refined over the weeks and months, particularly the criteria for available testing. Early on, we were very particular about who could get tested, and that has loosened, of course, and now it's more about where the reimbursement is coming from. So they've been able to adapt it over time.
Thank you. I guess to wrap up, we're at that hour limit here, time frame right now. Just the last question, I guess, to the panel here is what strategies have been most successful in educating the community, the residents, when and where they should get tested? And before I have all of you sort of respond to that in a wrap up, maybe a minute or two each to wrap up that question, I did want to let our viewers know that testing is not the most important thing here. Isolation is, mask wearing is. It's not so much if you have symptoms of an illness, it's obviously something you should be isolating yourself from others, both in your house and around the community. So that's the most important thing here. And testing validates what you may already know should you be symptomatic. But let's have folks talk about strategies that have been most successful in education in the community, and then we'll conclude this seminar. Let's go to Jason, Frank, Ryan, and Jerry.
So maybe I'm going to throw a little curveball at you, Steve, with this. And there's one thing we didn't mention is our approach in testing the homeless population. And one thing we've done that's a little unique is rather than getting the homeless population to come to the testing sites, which are 2 physical locations, we've been able to work with a local physician's practice that's been able to, through some grant funding, bring testing to the homeless population, which has been a key component in a very challenging population to address. So I just want to throw that out there. We've worked with a specific doctor's office around this, and be happy to talk with some folks offline if they're having challenges with the homeless population. But I'll pass the public information piece to Frank.
Thanks, Jason. Yeah, and I think Jason alluded to it earlier. Early on, we established a public information team that includes our county communication director, as well as my public information officer from public health and others from around the county. And it was really creating a relationship early on with our community about what was going on, being transparent, being as quick as we could with information to them. And that early relationship is what's kind of driven the conversation around testing. So our audience grew on our social media platforms and on our website, and I think people recognized us as a trusted source for information. So as testing became available, as the criteria for who could get tested changed, we were able to communicate that out through the channels that had been established. And because we had developed that credibility, I think people responded well, and that's really helped things go smoothly.
Ryan.
So my guess is that Lewis County was probably not as up to speed with technology and social media as some of our colleagues when this whole pandemic started, but we sure got up to speed quickly. We have held multiple press briefings that have been carried live on the county social media. That we're trying to display our partnership with the health system, the county government, and the public health department. At times school districts have been involved as well. So we've tried to show that we're one team. I liked what Frank said about trust. We actually did a survey in the Tri-County area up here, Jefferson, Lewis, St. Lawrence, and in Lewis County, our local health department polled higher than the CDC, higher than the president, higher than Governor Cuomo, higher than New York State Department of Health. People want to hear from us. We're their friends and neighbors. They know people that work at public health. They know people that work at the hospital. And when we communicate, I think it means something a little bit more. So that's been our strategy. And I think we have, like Frank said, built a reputation as a trusted source for good information.
Jerry?
I would build upon what Ryan has said. I think key partner meetings on a scheduled basis and in a disciplined manner has been very helpful. I think the media briefings have been very helpful. I also think from a health system perspective, we've provided updates to Ryan and his team, to public health, to the schools, to the board of legislators, and to the board of directors for the health system. And then as the largest employer in the county, our own internal communications to the medical staff and the employees. And we've been very disciplined there as well.
I'd like to thank our public officials from Tompkins County and Lewis County, as well as the examples and leadership in Broome County and Onondaga County. These, of course, are counties of populations under 500,000 in the state of New York. I'd also like to thank Tom Carey from Let's Get Checked. We have his information on there on the screen right now. Again, everybody, thanks so much. This is one of a series of programs that the New York Association of Counties will be offering as we go into this next second wave of this pandemic. We will be offering and featuring programs throughout the months of December, January, February, March, and as long as it takes to get through this. Thanks so much, everybody.